What if one of the most commonly quoted statistics in veterinary medicine isn't actually supported by strong evidence? You've probably heard this. Spay a dog before her first heat and her risk of mammary cancer drops to almost zero. After one heat, the risk jumps. After two heats, it jumps again. Those numbers have been repeated for decades in veterinary medicine. But when researchers actually went back and systematically reviewed the evidence, they found a problem. For years, veterinarians have commonly been taught numbers roughly like this. A dog spayed before her first heat has about 0.5% of the mammary tumor risk of an intact dog. And after one heat, it's about 8%. And after two heats, it's about 26%. And after that, spaying supposedly provides little protection against mammary tumors. Those numbers became incredibly influential in deciding when female dogs should actually be spayed. But where do they come from? So in 2012, researchers from the Royal Veterinary College decided to find that out. They performed a systematic review specifically asking whether neutering actually reduces mammary tumor risk and whether the age at which a dog is spayed matters. They screened over 11,000 search results. And after all of that, only 13 studies actually met their criteria. Even more importantly, 9 of those 13 were considered at high risk of bias. The other 4 were only of moderate risk. Among those 4 moderate risk studies, 1 found an association between neutering and reduced mammary tumor risk. 2 found no evidence of an association, and 1 described some protective effect, but didn't provide any numerical results at all. So the authors reached a pretty remarkable conclusion. The evidence that neutering reduces mammary neoplasia is weak at best, and the evidence that age at neutering changes that risk is also weak. They specifically concluded that the available evidence was not a sound basis for firm recommendations. Now, this does not mean that spaying doesn't reduce mammary tumor risk. That's an extremely important distinction. Absence of strong evidence is not evidence of absence. The problem is that most of these studies are observational. You can't easily randomize thousands of puppies to spay before the first heat and spay after the first heat and spay after the second heat and never spay and then follow them for 12 years. Doesn't happen. And there are enormous potential confounders here. Breed, genetics, age, body condition, hormonal exposure, geography, why the owner chose to spay in the first place, and even differences in veterinary care. Here's where this gets even more interesting. In 2025, researchers published another systematic review specifically asking, does prepubertal spaying reduce mammary tumor risk? They reviewed the newer literature published since that earlier systematic review. Again, 13 studies ultimately met their criteria, and 6 of the 13 found no evidence that early spaying protected against mammary tumors. But some of the studies did find protection, and this is why we shouldn't swing the pendulum too far the other way. Several studies did report lower mammary tumor risk in dogs that were spayed earlier. For example, one study in the newer review examined 600 dogs and found significantly lower mammary tumor risk in dogs that were spayed before 2 years of age compared with dogs spayed later or dogs that were left intact. So there's absolutely evidence pointing toward a protective effect. The problem is that the overall literature is inconsistent and vulnerable to confounding factors. So should we stop spaying dogs? That's not what the papers say. Spaying has other consequences that have nothing to do with mammary cancer, including prevention of pregnancy and essentially eliminating the future risk of pyometra after complete removal of ovarian function. And timing may involve trade-offs involving orthopedic disease and urinary incontinence and potentially other diseases depending on the individual dog. The more important point is much narrower here. We probably shouldn't present the classic mammary cancer numbers, 0.5%, 8%, and 26%, to owners as though they are precise, unquestionable biological facts. The biological hypothesis is absolutely plausible. Mammary tissue is hormone responsive, and reducing lifetime ovarian hormone exposure could plausibly affect tumor development. But plausible biology and strong clinical evidence are not the same thing, and more than a decade after researchers first questioned the quality of this evidence, a newer systematic review still concluded that we need better studies. So instead of saying you have to spay before the first heat because mammary cancer risk goes from 0.5% to 8%, a more scientifically defensible conversation is something like this. Early spaying may reduce mammary tumor risk, but we don't know the magnitude of that protection nearly as precisely as those famous numbers suggest. Follow me for more evidence-based veterinary medicine.